This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Hey there, welcome back to Yeah, We're Going There. I'm Dr. Natalie, and today we're going to discuss a topic that affects the majority of men, and yet nobody's talking about it. I want you to picture three things: a walnut, an apricot, and a lemon. Now, what if I told you those aren't snacks? Those are your prostate at 20, at 40, and at 60. Your prostate grows throughout your entire life, and for most men, that growth eventually causes real, disruptive, quality of life stealing symptoms. We're talking waking up multiple times a night to pee, standing at the toilet, straining, feeling like you never quite emptied, and quietly wondering, is this cancer? Today we're breaking down BPH, benign prostatic hyperplasia, what it is, what it does to your body, and why it's so wildly undertalked, and what you could actually do about it, including some things that are squarely in my wheelhouse as a pelvic floor physical therapist. So let's go. Let's start with that fruit analogy because I love it and I think it reframes everything. The prostate is a small gland that sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. At age 20, it's about the size of a walnut, cute, compact, not causing anyone any problems. Then, around age 25, the prostate enters what's called its second growth phase. It starts slowly expanding. By age 40, we're looking at something more like an apricot. Still not usually causing symptoms yet, but it's growing. By 60, lemon-sized. And now you've got a lemon wrapped around the tube you need to pee through. As the prostate enlarges, it squeezes the urethra, and the bladder has to work harder to push urine through a narrower opening. Over time, the bladder walls thicken from all that effort, and a thicker bladder wall means less room to store urine. So now you need to go pee more often, with more urgency, and you still might not feel fully empty. That's BPH, and it's incredibly common. Here's what gets me. 80% of men will develop BPH in their lifetime. That's 80%, and a third of those men will develop symptoms significant enough to need treatment. BPH is responsible for 6.4 million doctor's visits and over 400,000 hospitalizations every year. It is a massive driver of decreased quality of life, including disrupted sleep, anxiety around bathrooms, avoiding social situations, and impacting intimacy. Symptoms typically start showing up in a man's 50s. By the 50s, about half the men are affected. By age 85, up to 90%. So we are essentially saying this is a near universal male experience, and yet the conversation around it is almost non-existent. Men are embarrassed. They assume it's just aging. They don't bring it up with their doctors. Their partners don't know what's going on, and they suffer quietly. That's exactly why we're going there today. I need to spend a minute here because this is one of the most common fears men have, and it's worth being really direct about. BPH is not cancer. It will not turn into cancer. Having an enlarged prostate does not mean you have prostate cancer or that you're going to get it. These are two completely separate conditions. Now, I get the confusion because the symptoms overlap a lot. Both BPH and prostate cancer can cause a weak urine stream, frequent urination, and difficulty emptying the bladder. So it makes sense that men get scared. Here's one key difference. Prostate cancer symptoms often extend beyond the bladder. We're talking about pain in the hips, back, or chest, weakness or numbness in the legs, blood in the urine or semen, loss of bladder or bowel control. Those are red flags that go beyond what BPH typically causes. BPH symptoms are almost entirely urination-focused because what's happening is mechanical. The prostate is physically squeezing the urethra. The plumbing is getting compressed. That's the story. If you have any of those more systemic symptoms, the pain, the neurological stuff, then you need to go see your doctor. But if you're dealing with urinary frequency, urgency, weak stream, nighttime trips to the bathroom, that's very likely BPH, and it's very treatable. So, you've got BPH. What now? Treatment comes in three main buckets: pelvic floor physical therapy, medication, and surgery. And yes, I said pelvic floor physical therapy first because that is where we start, and it is genuinely effective. Pelvic PT for BPH is not what most people picture. We're not talking about doing 100 Kegels. Actually, for BPH, the work is often the opposite. We're focused on relaxation of the pelvic floor muscles because when those muscles are tight, they make urinary symptoms worse. We also work on toileting position. Something as simple as sitting to urinate with your feet elevated can make a significant difference in how well the bladder empties. We layer in behavioral modification, bladder training, and education about what's aggravating the symptoms. Medications typically fall into two categories: smooth muscle relaxants, alpha blockers, which relax the muscles in the prostate and bladder neck so urine can flow more easily. The other category works by actually shrinking the prostate over time by blocking the conversion of testosterone to DHT, which is a key driver of prostate growth. Surgery is on the table for more severe cases. The most common procedure is called a TURP, or transurethral resection of the prostate, which removes excess prostate tissue from the inside, reducing the compression of the urethra. About 90% of BPH surgeries are done this way. It's effective, but it comes with risks like bleeding, UTI, and urinary retention. So it's typically reserved for when other options haven't worked. The good news: most men respond really well to conservative treatment and medication. You don't have to white knuckle through this. Okay, let's land this plane. BPH is a walnut that becomes a lemon. It affects the vast majority of men. It disrupts sleep, bladder function, and quality of life. And it is not talked about nearly enough. If you are a man listening to this, or you love a man who is quietly dealing with bathroom struggles, I want you to know that this is common. This is treatable. And there's nothing to be embarrassed about. The pelvic floor doesn't care about your gender. It just wants to function well. Bring it up with your doctor. Look into pelvic floor physical therapy. Don't wait until things get so severe. As always, I'm Dr. Natalie, and this has been Yeah, We're Going There. If this episode resonates with you, share it with someone who needs to hear it, because the more we talk about this stuff, the less power the silence has. See you next time. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there, because knowledge drives better health.